2 research reports have been issued that speak to the value of expanding Medicaid in the state of Wisconsin. Let's look at these reports one at a time. The first one comes out of the University of Wisconsin. This is the Center on Research on the Wisconsin Economy. The report was titled Private Healthcare Spending and Medicaid Expansion, Evidence for Wisconsin. 2 economists took a bunch of data about the value of Medicaid expansion, looking at uncompensated care, other healthcare figures, and estimated the cost and savings based on that data. And that included a lot of health spending data and insurance coverage data as well. This reevaluated previous reports coming out of the CRO, out of that Center of Research on the Wisconsin Economy, and it used the same data but came to dramatically different conclusions. These new results, as issued in the report, and we link to the report in the description below, they say that Medicaid expansion could save the state of Wisconsin up to nearly $100 million annually. The numbers that made the biggest difference was that reduction in uncompensated care cost. These savings, they said, exceeded the cost to private insurance, and even their most pessimistic scenario, Medicaid expansion would still provide a net savings. Now, what's different about this second evaluation of these health spending and insurance coverage numbers, as opposed to the prior report, was that these economists controlled for long-term time trends in healthcare costs, adjusted expenditure data for inflation, and provided a fresh analysis of ER visits controlling for time trends. But the biggest difference was really looking at that huge uncompensated care cost number and what happens to that number if people go into the healthcare facility with insurance coverage. Now, we said there were 2 reports. The second report was released in a press release from the insurance commissioner here in the state of Wisconsin. Mark Affable issued a release saying that there was a report conducted by the consulting firm of Wakely. It's an independent actuarial firm, and they came to the conclusion that premiums on the individual market were lower, 7 to 11% lower in states that expanded Medicaid. So their take on the value of Medicaid expansion is in terms of how it actually affected the private insurance market. Now, they issued quite a lengthy report. They show their analysis and the data, and we provide that report in the link below as well so you can read it. If you have questions on the value of expanding Medicaid for Badger Care Plus in Wisconsin, you can send us your question, share your story, contact your legislature. You can find all of that information on healthwatchwisconsin.org.